Hi guys, welcome to the office. We're going to take about 15 minutes here and really explain to you your spine, your health, and how the nervous system works. Because you really need to know these things to get you back to 100%, get you out of pain, get your body working better. And one of the main things we did, we took x-rays, we did an exam, and once we go over that, we're going to go over the basics, and then we're going to show you your individual x-rays and your exam so you understand exactly what you can do to get back on track. And the main reason that we even took x-rays is because we're looking at your nervous system. Okay? We don't really care about the bones or the x-rays, but we know that your brain and your nervous system is housed in the spinal column. And by taking those x-rays, we can see exactly how your nervous system is working, how well the brain is able to communicate down your spinal cord, out the nerves, to your heart, your lungs, your digestive system, to your arm, whatever it may be. So those x-rays are really the blueprint and let us know, mostly what we need to know. So when we're looking at that x-ray, there's two things that we're looking for. We're looking for the structure. Structure is very important. It's the same reason, a building has a structure or a dome has a curve to it, because it's structurally sound and it lasts longer. It stays healthier, if you will. The second thing we're looking for is motion. Most of us have heard the statement, if you don't use it, you what? You lose it. And the same thing applies to the spine. A lot of us have been in car accidents, sitting at a desk all day, and things in our spine stop moving. And that leads to deterioration. And we're going to go over if we found those things in your spine, and if we do, we can absolutely help you. So again, when we're looking at the structure, there's two things we want to see as well. We want to see three curves from the side. Curve in the neck, curve in the thoracic, curve in the low back here. Now, from the front, we want to see the opposite, or from the back. We actually want to be completely straight. When it's not straight, that can obviously compress, pinch on those nerves as well. So again, we're looking for structure and we're looking for motion. So now let's go ahead and move into your x-rays and show you exactly what that looks like. The first thing we're looking for at your x-rays is that curve in your neck. So I want everyone to make an arc like that with your hand. Now when you have a nice curve in there, the skin is nice and relaxed and it actually acts as a spring. Now I want you to go ahead and actually open that curve up all the way. And what do you feel on the skin in your hand right there? You're actually going to feel a stretch. And also go ahead and press down with your hand like that. It actually jams into the nerves in your neck when you lose that structure. Not only that, again, it stretches the skin in the hand. So what they actually found out is when you lose that curve, it stretches the spinal cord by anywhere from 18 to 22%. So obviously that can cause headaches and neck pain, but it's also decreasing the neurology. It's decreasing your brain's ability to transfer information through your neck into the rest of your body. Now the most important thing I want you to really see here, because again, this is where your problems are coming from, is this actual loss of curvature. The blue lines are the back of your vertebral bodies. Again, that is supposed to make an arcing line. Now the red line is where your neck should be. So on the left-hand side, you can see here how that neck is completely straight, compressing those nerves, causing those issues. Now on the right-hand side, can you see how the blue lines now match the red line? This is someone that went through a structural correction program only a couple months later, got that natural curve back in there. It took the damage and pressure off those discs, off those nerves. Numbness went away, headaches went away, energy went up. Again, just by fixing that structure in the neck. The next thing you can see here is when you lose the curve, how it's actually decreasing the diameter of the spinal cord, and that's really important. The next x-ray I want you to see here is you can see this person's completely lost the curve, and it's actually starting to go the other direction, which gravity has played a large part of that. And on the right, you can actually see their MRI and how that loss of curve is affecting their spinal cord. And if you look very closely, you can see how that spinal cord right there in the middle is actually starting to be compressed. It's literally, neurologists say it's like taking a garden hose and stepping on it. The water's not going to get through a garden hose. Same thing in the spine. The information from your brain is not going to get through there. And a good example of this is Christopher Reeves. And he fell off a horse. He fractured that very top bone in his neck. And that top bone only moved 1 centimeter into his spinal cord. It actually shut his function down by 80%. I don't know if Christopher Reeves believed in what we do, or if he believed in chiropractic or physical therapy or anything else, but it's not about a belief. It's how the body works. It's the physiology of the body. If the brain cannot communicate to the organs, you're gonna have issues. And it's really as simple as that. So the next thing I wanna look at here is forward head posture. So they actually found out that every inch your head comes forward, it doubles the weight of your head. So if you're here, there's only 10 pounds of pressure. If your head comes forward 2 inches, you now have 30 pounds of pressure on the nerves in your neck and on the spinal cord. So in the study, they actually found that forward head posture can actually pull the entire spine out of alignment. They also found that when the head comes forward like that, it can decrease heart function and its efficiency. It can also decrease lung function with the O2 exchange in there, just from forward head posture, just from a postural change. And the last thing they found, that it can actually decrease your ability to digest food by slowing down peristalsis, prolonging the time that fecal matter stays in your colon, just from forward head posture. So that's really how important it is. And another medical study they did, they found that forward head posture leads to long-term muscle strain, disc herniations, arthritis, and pinched nerves. Again, that's not me saying that, that's the Mayo Clinic coming out with that. So what does that look on x-ray? Because when I show you your x-rays, I want you to know exactly what's going on and what that looks like in your body. So here you can see this person, their head has come forward 6.4 centimeters. That's about another 20 pounds of pressure on the spine. And about 3 or 4 months later, going through an entire rehab program here, they're now down to 2.4 centimeters. That's about 15 pounds less pressure on the nerves in their spine. They had numbness in their arm, they were having headaches, a lot of trigger points, heart palpitations because of this compression. In just 3 or 4 months, we were able to get their ear back over their shoulders, get pressure off those nerves, and literally every single one of those symptoms went away. It's just amazing what can happen. One more thing I want to talk about with forward head posture. Everyone has postural muscles that are supposed to hold your head in the correct position. You also have phasic muscles that are designed to lift weights, move your arms, do all those things. Now, when those postural muscles have to hold 10 pounds of weight, when your ear is over your shoulder, they can do that. They can do that all day, every day. When those muscles have to have 30 or 40 pounds, your phasic muscles, your big muscles come in and are recruited to try to hold that head up. They're not long distance runners. They become fatigued. When those become fatigued, guess what you get? You get trigger points. You get tightness in your traps. You get headaches. Those are so common, and that's from the phasic muscles having to do what the postural muscles used to do. Now, one of the last x-rays I want to show you is of the lumbar spine, the low back. Again, you want to be straight from the front. This is someone that has a mild scoliosis. They having reproductive issues, digestive issues, low back pain because of this lower curvature. And a lot of you guys I'm seeing that on your x-rays, and it's causing a lot of the issues. I see with sciatica, numbness in the foot, gait issues. And this is someone, again, about 3 or 4 months later. Can you see the difference here? Huge change in the spine. We got motion in there, and we got the structure back. And it's just amazing that the things that can happen. So, how do we fix these issues? There's a 3-step process to fix these issues. It's called mix, fix, and set. Now mixing is warming up the tissues, breaking up the scar tissue, and like I spoke of earlier, getting motion back in the joint. Loss of motion was causing the arthritis, the degeneration, the pain, all these issues. So that's the mix. The fix is the actual physical adjustment. That's moving the bones back in the right place. That's getting that structure back that I told you guys about. Those are the 2 things that are causing your issues, is lack of motion and a structural issue. Now, if we just adjust you and we try to get that structure back, but we don't break up the scar tissue, what's going to happen? Yeah, it's going to go right back. So we have to make sure that we rehab the spine, we break up the scar tissue, we get things moving first. That's the mix. We then fix it and put it back in its proper alignment. Now, if I did that, we did the mix, we did the fix, you're doing better, and we say, hey, see you later, you go get in your car. Well, what is your spine and your health problems? What do they immediately want to do? Yeah, they want to come right back. They want to, old habits. Your body wants to do what it's used to. And that's why we've, through a lot of technology and a lot of research, we've implemented what's called the SET. And that's retraining your neurology and your muscle memory to hold your spine in that new position. One of the number one ways we do that is through something called vibration therapy. Now, vibration therapy literally retrains your muscle memory to hold your spine in that new position. So next time you come in, we're starting where you left off instead of starting all over. Because if we start over every time you come in, we're not going to get very far. And there's a really important concept I want to talk about, and that's called synergy. You guys have ever heard of 1 + 1 = 3? So when we implement, chiropractic and physical therapy and all these things together, the sum of those things is going to be much greater than if we do one thing by itself. That's why I have so many patients that tried physical therapy or they tried chiropractic and they didn't get the results they wanted. And that's because no one has put them all together and done them the right way to get you the best results possible. It's the same thing if I'm trying to build a brick wall and I have to pick every brick up by myself and put it up on the wall, and I'm on a ladder, it's going to take forever. But if I get someone down below throwing me the bricks and I'm putting them up there, I will literally get it done 10 times quicker. That's exactly what we're doing by putting all these things together, is we're getting results 10 times quicker. Instead of this taking a year or 2 years, we're getting results in just a couple months. So really getting some phenomenal results. So one of the last things I want to talk about, what does treatment look like? The thing I want to preface this with is, if you go and work out once a month, are you ever going to get stronger? Absolutely not. You're going to stay where you're at, but you're never going to get stronger. It takes a physical force to change your spine. Medication is not a physical force. This takes time. This takes repetition. Again, if you work out 2 or 3 times a week, you're obviously going to get a lot stronger, a lot quicker. You can work out once every month or every couple months, and you can maintain that. Your spine is really the exact same way. So we base all treatment plans off the research and off results. What the research is showing that every 36 visits equals about 13 to 14 degree correction in the spine. They're also finding each treatment you can get about 1 millimeter of change or about the same thickness as a piece of paper. So, I wish people could come in, degenerated spine, all these issues, and I could literally come in there, boom, completely change that structure in one adjustment. I wish I could. The spine just does not work that way. If I could adjust you and get that much change, that'd be like some type of crazy Chuck Norris adjustment, right? And trust me, you do not want that. So again, is one adjustment, 1 millimeter, going to change everything? Probably not. But again, if I can put 20 sheets of paper together, now we're going to start to make significant improvements to the spine, and we're actually going to make a lasting change. So with your spine, there's 3 phases to get permanent results. The first phase is really changing the structure. That's a very intensive phase. It takes some time, but we're going to get very quick results. The second phase is really stabilizing the spine and letting that settle in. Again, your body wants to go back. So in phase 2, we need to strengthen the muscles and the ligaments to hold you in that new structure. So, the herniations don't come back, the numbness, all the spinal problems that you're having, so those do not come back. Now the third phase is one of the most important, and that's the maintenance. Let's keep this where it's at so it never comes back. Whether that's once a month, once a year, whatever it takes to keep you where you're at. One of the last things I want to say about that is, just kind of as a warning, you might feel a lot better after one adjustment. We might get you just over that hump. You don't have a symptom until you're at 60% function, which is pretty decreased. I might get you from 59 back to 61. That doesn't mean we've got you all the way there. Yeah, you might feel better, but I'm telling you guys, stick the course, get your body functioning back at 100%. And that really takes going through all 3 phases. We want to prevent this thing because that is the cheapest and most effective way to do it. So the average American spends $7,300 a year on healthcare. A lot of people say, oh no, well, I don't have to pay for that. My insurance pays for that. Who pays for insurance? Yeah, we do. We're splitting all those costs. So you might not think you're paying for it, but you are 100% paying for it. Again, I just show you those costs so that you can understand how much better it is to prevent something, how much cheaper it can be to prevent those things. So really start to look at time and start to look at money so you can make the best decision possible. So they found that people, and this is just chiropractic in general, people that their primary care provider is a chiropractor have 60% less hospital visits, 85% less pharmaceutical costs, 59% less days in the hospital, and 62% less outpatient surgeries. If this is something that you guys can't do, that's fine. If you have other things going on in your life or other routes you want to go, 100% fine with us in this office. But again, if it's a time or it's a money thing, I just strongly encourage, do your research, look at the numbers so that you can make the right decision for you. You know, another common question I get is about insurance, and that's a very valid question. And you know, I had a patient and she needed a certain service, and I just felt like insurance should cover it because that's what the patient needs to get healthy. I thought insurance was there to get you healthy, right? And this is actually what Medicare, their guidelines are and what they told me. They said a treatment that plans and seeks to prevent disease, promote health, and prolong and enhance the quality of life, or a therapy that is performed to maintain or prevent deterioration of a chronic condition is deemed not medically necessary. And that blew my mind. So basically, what they're saying is we're just trying to get you out of acute care. We have really good emergency care. Again, you don't have a symptom, you're at 60%. Insurance's job is to get you from almost dying to over 60% so you don't have a symptom. Insurance is not paid to get you from 60% back to full health. That's just how it's designed. So in a minute, we're going to come in, we're going to show you exactly what your x-rays look like, why it's causing the issues you're having, and really outline a detailed treatment plan on how we're going to get you the best results possible. God bless. We'll see you in a minute.